it's been clear that the pandemic's health and economic impacts have fallen hardest on communities of color, including immigrant families. Unfortunately, what we've seen is that coronavirus legislation that's been enacted so far doesn't go far enough to help immigrant families, and it's leaving millions without access to essential programs. So as we continue to advocate for more immigrant-inclusive legislation, we want to make sure that families are aware of the programs they may be eligible for right now. So I'm going to briefly review eligibility for healthcare, cash assistance, food assistance, and unemployment insurance. And before I start, I just want to flag that this eligibility information is also available in the form of a quick reference guide on our website at protectingimmigrantfamilies.org. We have the quick reference guide available in both English and in Spanish. So first, let me talk about healthcare. On healthcare, our message to immigrant families is that it is safe and smart to seek testing and treatment for COVID-19. We encourage everyone, including immigrants, to seek the care that they need during this difficult time. Federal legislation has provided funds to healthcare providers, including community health centers and hospitals, to cover COVID testing and treatment of uninsured people. Immigrants can continue to access healthcare services at community health centers, regardless of their immigration status. We are seeing evidence that immigrants are afraid to access medical treatment for COVID because of public charge and concerns about potential immigration consequences. It's really important that we spread the word that testing, treatment, and preventive care related to COVID-19 will not be included in a public charge determination, even if the healthcare services are covered by Medicaid. Additionally, we want to make sure that immigrant families are aware that healthcare workers should not be asking them information about their immigration status. Hospital emergency rooms and community health centers will provide treatment whether or not someone has insurance, money, or immigration documents. It's also really important to emphasize that information that people provide when they're applying for health coverage or when they're seeking medical treatment, that information is not shared with immigration enforcement officials. Next, I want to talk briefly about cash assistance. Under the CARES Act, most people earning less than $75,000 a year are eligible for a one-time cash payment of $1,200, and that should be issued automatically. Married couples should each receive a check, and families are eligible for $500 per child. Unfortunately, right now, there is a Social Security number requirement that excludes many immigrant and mixed status families from receiving this stimulus payment. If one partner in a married couple filing jointly household uses an I-10 number instead of a Social Security number to file their taxes, no one in the household is eligible for the payment, including their children, even if those children are US citizens. So for those who are eligible for the stimulus payment, one thing that's important to know is that receipt of the stimulus payment is not taken into account in the public charge determination. So that means that receiving the stimulus payment will not negatively impact someone's ability to get a green card in the future. Next, let me talk about food assistance. Eligibility rules for SNAP, or also known as food stamps, has not changed at this time. But we do want to spread the word about a new nutrition assistance program that is now available in over 40 states. The program is called Pandemic EBT, or PEBT for short. And PEBT provides nutritional resources to families that have lost access to free or reduced price school meals during school closures due to COVID-19. Families who are eligible for PEBT will receive those funds directly on a new or existing EBT card to help fill in the school meals gap. For many immigrant families that have been excluded from unemployment assistance and stimulus checks, PEBT may be the only new resource that's available right now to help them weather this very challenging time. So we hope that you will help us spread the word about PEBT and make sure immigrant families understand that there are no immigration status requirements to receive PEBT. Unfortunately, under our current unemployment system, undocumented workers are not eligible for federal unemployment benefits. The general rule is that workers need a valid work authorization in order to be eligible for unemployment benefits. Now I want to pivot and talk just a bit about some state and local help that may also be available. What we've seen is that in recent months, several states and localities have really stepped up to provide greater and more equitable access to programs for immigrant families. One great example is in California, where Governor Newsom announced the California Disaster Assistance Program. This program provides help to undocumented adults who are ineligible for federal assistance and who have experienced a hardship as a result of COVID-19. An undocumented adult in California who qualifies can receive $500 in direct assistance with up to $1,000 of assistance per household. And that state funding is expected to reach about 150,000 undocumented adults in California. There are a lot of other amazing examples of programs that are specific to certain states and certain cities. So we encourage immigrant families to reach out to local nonprofits and to legal services organizations in their area to find out what may be available and what the deadlines are to apply for programs. Finally, to close, I just want to highlight again that all of the eligibility information I shared today is available on our website at www.protectingimmigrantfamilies.org. People with temporary protected status, specifically on their eligibility for health coverage. Under the Affordable Care Act, individuals with temporary protected status are considered lawfully present, which means that they can qualify for to purchase health insurance in the federal marketplace and in state-based marketplaces. And depending on their income and other factors, they may also qualify for financial assistance. As far as Medicaid eligibility for individuals with TPS, federal Medicaid eligibility is limited. There are certain states that have opted to provide federal Medicaid coverage to pregnant women and children who are lawfully present, and that would include individuals with TPS. There are other states that provide Medicaid with state funds to all individuals, to all children, regardless of immigration status. So once again, if individuals are uninsured and they are curious about what the health insurance options are in their state, including if they have TPS and they're trying to find out what's available to them,